What in processed food told you that there's one nutrient, one single electrolyte. So critical to life. Without it, your heart won't beat correctly, your muscles won't function, and your brain can't think straight, yet millions of people walk around deficient in it every single day. Not calcium, sodium, not potassium. It's magnesium. Magnesium is the fourth most abundant mineral in the human body. It's involved in over 600 biochemical reactions. Everything from energy production, nerve transmission, to muscle contraction and DNA repair. And still, it's one of the most overlooked and underappreciated nutrients in modern medicine. This is the paradox. How can something so vital be so ignored? Let's start with the role magnesium plays at the cellular level. Every single one of your cells relies on ATP, the energy currency of the body. But ATP doesn't float around freely. It must bind to magnesium, be biologically active. That's right, without magnesium, ATP is useless. And without ATP, you're not alive. Now think about this. The average person consumes diets high in processed foods, refined sugars, and poor quality fats. These foods are virtually devoid of magnesium. Combine that with soil depletion. Modern agricultural methods strip our soils of minerals, including magnesium, and we're left with crops that are grown bigger and faster, but with a fraction of the nutrients they once had. The result, a silent epidemic. Magnesium deficiency is not rare. It is rampant. Studies suggest that up to 70% of people in developed countries fall short of optimal magnesium intake. But here's the thing, you won't find many doctors checking magnesium levels unless an emergency. Even worse, the test that is often used, the serum magnesium level, is misleading. Less than 1% of magnesium is stored in your blood. The rest, it's in your bones, muscles, and cells. By the time serum magnesium is low, your deficiency is already severe. Let's talk symptoms. Do you feel tired all the time? Do you get muscle cramps or twitches? Are you anxious? Do you have trouble sleeping? Is your heart racing or skipping beats? These aren't just minor nuisances. They could be your body crying out for magnesium. And then there's the bigger picture. Magnesium is intricately connected with insulin sensitivity and blood sugar regulation. Low magnesium contributes to insulin resistance, the very root of type 2 diabetes. It's also involved in regulating blood pressure and maintaining the flexibility of blood vessels. Deficiency has been linked to hypertension, arrhythmias, migraines, even depression. But what about stress? We live in a world where our sympathetic nervous system, the fight or flight system, is constantly activated. Cortisol and adrenaline surge through us day and night. Magnesium is nature's original chill pill. It calms the nervous system, quiets excessive neuronal firing, and promotes parasympathetic tone, that rest and digest mode we're all missing. And just when we need it most, we lose it. Stress, caffeine, alcohol, diuretics, all drain magnesium from the body like a leaky bucket. It's a vicious cycle. Stress depletes magnesium, and low magnesium amplifies stress. Athletes lose it through sweat. Older adults absorb less of it. People on acid-blocking drugs or diuretics dump it in their urine. Even seemingly healthy individuals may be running on empty. First, recognize that the recommended daily allowance, around 400 mg, is not a target of optimal health. It's the minimum to prevent overt deficiency. But optimal levels for brain function, cardiovascular health, metabolic control, and muscle performance may be much higher. Second, we must get serious about whole foods. Leafy greens, nuts, seeds, avocados, legumes, these are magnesium powerhouses. But how many people eat these daily? Not enough. And some may need supplementation, especially those with chronic health conditions, high stress, or poor diets. But here's the most important message: we can't afford to ignore magnesium any longer. It is not an optional nutrient. It is foundational. It's the quiet stabilizer behind every heartbeat, every nerve impulse, and every breath you take. And it's disappearing from our plates, our soil, and our awareness. Magnesium may be the most important electrolyte in your body, and yet it's part of an ignored epidemic. It's time to change that. Magnesium is one of the most vital yet underappreciated minerals in the human body. It serves as a cofactor in more than 600 enzymatic reactions, making it foundational to nearly every system that keeps us alive and functioning. Among its most critical roles is the activation of ATP, or adenosine triphosphate, the body's main energy molecule. ATP is required for every biological function, from muscle contractions and nerve signaling to cellular repair and detoxification. However, ATP does not function on its own. It must bind with magnesium to become biologically active. This complex is known as MgATP, and without it, energy metabolism stalls. In a very real sense, magnesium is the spark plug of life, igniting every cellular engine across every tissue in the body. At the cellular level, magnesium is required to stabilize enzymes, transport ions across cell membranes, and maintain proper electrical potentials in nerve and muscle tissue. It ensures the correct function of the sodium-potassium pump, which maintains the electrochemical gradient across the cell membrane. Without this gradient, nerve impulses can't be transmitted, muscles can't contract efficiently, and organs can't coordinate their functions. That means your heart's rhythm, Your breathing patterns and even your cognitive ability are all deeply dependent on magnesium's presence, and magnesium plays a central role in protein synthesis and the creation of DNA and RNA. It regulates hundreds of signaling pathways and metabolic processes that determine everything from insulin sensitivity to neurotransmitter release. It supports detoxification pathways in the liver, ensuring that harmful substances are neutralized and eliminated. It influences gene expression and acts as a guardian against oxidative stress, helping to neutralize free radicals and preventing cellular damage. Every heartbeat, every breath, every thought. Magnesium is there in the background, orchestrating it all with silent precision. Its essential nature, magnesium, is often neglected in both clinical settings and everyday nutrition. Its critical role in activating ATP means that a deficiency can compromise the body's energy production at its core. People who are magnesium deficient often complain of unexplained fatigue, brain fog, poor concentration, and overall weakness. This isn't just anecdotal, it is cellular energy deficiency manifesting as systemic fatigue. Without magnesium, cells struggle to create and use energy efficiently, leading to a cascade of functional breakdowns across the body. In muscle tissue, magnesium is necessary for both contraction and relaxation. It acts as a natural calcium channel blocker, helping to control how much calcium enters a muscle cell. Without enough magnesium, muscles may become overly excitable, leading to cramps, spasms, and twitching. This same excitability can affect the smooth muscles lining blood vessels, potentially contributing to hypertension. In the heart, low magnesium can lead to arrhythmias, irregular beats that in some cases can become life-threatening. In the brain, magnesium is needed to regulate NMDA receptors, which are involved in learning and memory. Low magnesium levels can result in neuronal hyperexcitability, leading to anxiety, irritability, and even seizures in severe cases. The body's need for magnesium increases under conditions of stress, illness, and physical exertion. When we are stressed, our adrenal glands release cortisol and adrenaline, both of which require magnesium to be metabolized properly. At the same time, stress hormones promote the excretion of magnesium through urine, setting up a vicious cycle. More stress depletes magnesium, and low magnesium intensifies the stress response. This depletion isn't always obvious in blood tests, since only a tiny fraction of the body's magnesium resides in the bloodstream. Most of it is stored in bones, muscles, and soft tissues, where it quietly supports the body's internal chemistry. Even mild deficiencies can have a profound impact on energy metabolism, cardiovascular health, neurological function, and muscular performance. The body will attempt to compensate for a lack of magnesium by pulling it from bone and tissue stores, but this is not a sustainable solution. Over time, these stores are depleted and symptoms become more severe and persistent. From the cellular level to the whole body system, magnesium's presence or absence determines how efficiently energy is made, stored, and used. The modern diet has changed dramatically over the past century, and with it, our intake of essential minerals like magnesium has steadily declined. While magnesium, once abundant in the food supply due to rich, mineral-dense soil and whole food diets, today it is often absent from the average person's plate. The combination of processed food consumption, agricultural soil depletion, and food refinement has created a widespread and silent epidemic of magnesium deficiency that affects populations across the globe without many even realizing it. This widespread insufficiency is not isolated to developing countries or specific socioeconomic groups, but is seen even in individuals who consider themselves health-conscious. Highly processed foods dominate the modern plate. These foods have been stripped of their natural fiber, nutrients, and minerals, including magnesium. White flour, refined sugar, and processed oils contain virtually no magnesium, and yet they make up a significant percentage of many people's daily caloric intake. As people continue to gravitate toward convenience foods, staying away from foods, they unknowingly reduce their intake of the very minerals their bodies rely on for optimal function. Even many of the so-called healthy packaged foods lack meaningful amounts of magnesium because food processing tends to remove it during production. The result is a population that may feel full but remains nutritionally starved beyond food choices. Another significant factor contributing to the decline in magnesium intake is the quality of the soil in which our crops are grown. Decades of industrial agriculture and monopping have led to the depletion of essential minerals in the soil. Magnesium is one of the most affected, as repeated farming without adequate mineral replenishment gradually strips the soil of its nutrients. Even organic produce is not immune to this issue if the soil has not been properly remineralized. That means even when people do consume fruits and vegetables, they may still be getting far less magnesium than they would have a generation ago. Water, once a reliable source of magnesium, has also changed. In many areas, natural spring water that once flowed through mineral-rich earth has been replaced with filtered or chemically treated municipal water that contains little to no magnesium. Furthermore, the widespread use of water softeners, which replace magnesium and calcium ions with sodium, has reduced another potential source of this vital mineral. People are drinking more bottled water than ever before, much of it is distilled or purified and completely devoid of magnesium. These changes in both diet and water supply have created a nutritional environment that almost guarantees magnesium insufficiency. Lifestyle choices compound the problem further. The widespread use of caffeine and alcohol, both of which increase urinary excretion of magnesium, contributes to further depletion. Many medications, including proton pump inhibitors, diuretics, certain antibiotics, and birth control pills also promote magnesium loss or impair absorption. Chronic stress, which activates the adrenal glands and increases the precortisol and adrenaline, causes magnesium to be used up at a faster rate. This creates a compounding affecting poor intake combined with increased loss. Even exercise, while beneficial overall, increases magnesium requirements due to losses in sweat and greater cellular demand. The result is a perfect storm of low intake, poor absorption, and accelerated loss that leaves millions of people functionally deficient. Unlike acute medical conditions that come with clear symptoms and straightforward diagnosis, magnesium deficiency often presents with vague, chronic, and nonspecific symptoms that are easily dismissed or misdiagnosed. Fatigue, irritability, anxiety, muscle twitches, headaches, and poor sleep are just a few of the signs that may indicate magnesium depletion, yet these are rarely linked back to nutritional causes in conventional medicine. The slow, creeping nature of deficiency allows it to go unnoticed, silently contributing to the development and worsening of chronic diseases. The cumulative effects of this mineral depletion are not only seen at the individual level, but ripple out to public health systems. As magnesium is involved in cardiovascular regulation, metabolic stability, bone strength, and neurological health, its deficiency plays a role in the rising rates of hypertension, type 2 diabetes, osteoporosis, depression, and sleep disorders. Addressing this silent epidemic requires not only awareness but a fundamental shift in how food is grown, processed, and consumed. This is not a matter of simply adding another supplement to a daily routine, but of recognizing a widespread environmental and lifestyle-driven deficiency that has become a hidden contributor to many of the chronic conditions plaguing modern society. When assessing magnesium status in clinical settings, the standard practice is to measure serum magnesium levels. However, this method is fundamentally flawed and often misleading. Less than 1% of the body's total magnesium is found in the blood, and of that, only a fraction exists in the serum portion that is typically measured. The vast majority of magnesium is stored intracellularly, particularly in bone, muscle, and soft tissues, where it performs its most critical functions. Relying on serum magnesium as an indicator of overall magnesium status is akin to checking the water in a faucet to estimate the amount in the entire plumbing system of a building. Because of this compartmentalization, magnesium levels can appear perfectly normal in the blood test even when the body's cells and tissues are severely depleted. The body prioritizes keeping blood magnesium within a narrow range, since even slight deviations can have dangerous consequences for heart rhythm, nerve conduction, and muscle function. To achieve this balance, it will pull magnesium from bone and tissue stores if necessary. As a result, a serum level in the normal range does not rule out a significant deficiency at the cellular level. This leads to a major blind spot in medical diagnosis and leaves many cases of chronic magnesium deficiency undetected. This becomes even more concerning in patients who present with symptoms that could be explained by low magnesium levels. Fatigue, muscle cramps, arrhythmias, anxiety, and headaches are all signs that should prompt an evaluation of magnesium status. Yet if a standard serum test is ordered and returns a value within the normal reference range, further investigation is often dismissed. This reliance on numbers without context contributes to the underdiagnosis of magnesium-related disorders and delays necessary interventions that could improve patient outcomes. The normal reference range for serum magnesium is also quite broad and may not reflect the levels required for optimal health. A person at the low end of the normal range may already be experiencing functional deficiency, particularly if they have a high need for magnesium due to stress, illness, or medication use. Moreover, these reference ranges are often based on statistical norms rather than physiological ideals. In other words, they reflect average levels in the population, not necessarily what is best for long-term health. This creates a scenario where widespread deficiency skews the definition of what is considered normal in critically ill patients. Magnesium levels are sometimes monitored more closely, especially in intensive care units where arrhythmias, electrolyte imbalances, and organ dysfunction are common. Even then, the focus is often on correcting severe deficiencies rather than recognizing the broader implications of suboptimal magnesium status. Outside of these settings, magnesium testing is rarely part of routine blood panels stemming from processed foods, and most people will go through their lives without ever knowing their true magnesium levels. Alternative methods of assessing magnesium status do exist, such as red blood cell magnesium tests or magnesium loading tests, but they are rarely used in standard clinical practice due to cost, accessibility, and lack of awareness. Functional signs of magnesium deficiency are often more telling than lab results. Yet these signs require a clinician to think beyond the numbers and consider dietary habits, lifestyle medication use, and symptom patterns. This type of integrative thinking is essential but not always emphasized in conventional training, or furthermore, some populations are more vulnerable to having misleading serum magnesium results. Older adults, individuals with diabetes, and those with gastrointestinal disorders may have impaired absorption or increased loss of magnesium, and their lab results may still appear within range due to compensatory mechanisms. Athletes and highly active individuals who lose magnesium through sweat may also show normal serum levels despite being functionally deficient. Pregnancy and lactation increase magnesium demand significantly, yet routine screening for magnesium is not commonly done during these critical periods. The over-reliance on serum magnesium testing has led to a gap between the presence of symptoms and their root causes. Patients with vague, chronic issues are often told their labs look fine and are left searching for answers. This disconnect between clinical symptoms and standard lab interpretation underscores the need to view magnesium not just as a lab value but as a critical element in overall health. Understanding the limitations of testing is the first step toward addressing this hidden epidemic that continues to go unnoticed in both medical practice and public awareness. Magnesium deficiency often goes unnoticed because its symptoms are subtle at first, yet they are deeply woven into the body's day-to-day functioning. Fatigue is one of the earliest signs and is frequently dismissed or attributed to lifestyle factors like poor sleep or overwork. However, the fatigue caused by low magnesium is not ordinary tiredness. It originates from impaired cellular energy production. Magnesium is required for the activation of ATP, the primary energy molecule in cells. When magnesium is lacking, ATP cannot perform its job efficiently, and the result is a kind of whole-body energy shortage that leaves individuals feeling constantly drained. Muscle cramps and twitches are another hallmark symptom that many people experience without understanding the underlying cause. Magnesium plays a regulatory role in muscle contraction and relaxation. It works by counterbalancing calcium, which causes muscles to contract. When magnesium is deficient, calcium floods muscle cells unchecked, leading to overexcitation and involuntary contractions. These can manifest as eyelid twitches, leg cramps, restless legs at night, or spasms during physical activity. Some individuals wake up at night with painful cramping in their calves or feet, not realizing that their muscles are starving for magnesium. Anxiety and irritability are also linked to low magnesium levels. In the central nervous system, magnesium modulates the activity of neurotransmitters and maintains the balance between excitation and inhibition. When levels fall, neurons become hyperactive, leading to heightened sensitivity to stress, racing thoughts, and emotional instability. Magnesium acts as a natural calcium blocker at NMDA receptors in the brain, which are involved in synaptic plasticity and memory. Without sufficient magnesium to keep these receptors in check, brain circuits can become overstimulated, resulting in anxiety, mood swings, and difficulty concentrating. Sleep disturbances are commonly reported in individuals with inadequate magnesium intake. Magnesium supports the parasympathetic nervous system, promoting relaxation and preparing the body for rest. It also contributes to the regulation of melatonin, the hormone responsible for the sleep-wake cycle. Low magnesium levels can make it harder to fall asleep, stay asleep, or achieve deep, restorative stages of sleep, made from processed foods. Individuals may wake up frequently throughout the night or feel unrefreshed in the morning despite a full night in bed. This creates a vicious cycle, as poor sleep further depletes magnesium and exacerbates symptoms. Our heart rhythm irregularities are among the more serious consequences of magnesium deficiency and can be life-threatening if left unaddressed. Magnesium is vital for maintaining the electrical stability of heart muscle cells. It helps regulate the flow of ions like potassium and calcium, which are essential for the coordinated contraction of the heart. When magnesium is insufficient, electrical signals become erratic, leading to palpitations, premature beats, or even atrial or ventricular arrhythmias. Some people experience these irregular rhythms without any known cardiac history, and magnesium levels are often not as a possible factor. Headaches and migraines are another symptom category that may have roots in magnesium deficiency. Studies have shown that magnesium can affect serotonin receptor function, reduce the release of pain-producing substances, and improve blood vessel tone. Individuals prone to migraines may have lower brain magnesium levels during an attack. Supplementation has been found to reduce the frequency and intensity of migraines in susceptible individuals. Yet, despite this connection, magnesium is still rarely evaluated in patients with chronic headache disorders. These diverse and often non-specific symptoms make magnesium deficiency difficult to recognize, particularly in a medical culture that prioritizes acute, measurable conditions over subtle, chronic imbalances. Many individuals live for years with these symptoms, treating each one in isolation, taking sleep aids for insomnia, beta blockers for arrhythmias, antidepressants for anxiety, without addressing the root nutritional insufficiency that ties them all together. The body gives warning signs in small, persistent ways, but without awareness of magnesium's role, these signs are easy to ignore or misattribute to other causes. Over time, this unaddressed deficiency can escalate into more serious health problems that require greater intervention and care. Magnesium deficiency is increasingly being recognized as a contributing factor in the development and progression of several chronic diseases that now dominate global health statistics. One of the clearest links is with type 2 diabetes and insulin resistance. Magnesium plays a critical role in glucose metabolism and insulin signaling. It acts as a cofactor for enzymes involved in carbohydrate breakdown and influences the activity of insulin receptors on cell surfaces. When magnesium levels are low, the ability of cells to respond to insulin diminishes, which leads to elevated blood glucose levels and ultimately insulin resistance. This forms a vicious cycle because high blood sugar levels further increase the loss of magnesium through the kidneys, deepening the deficiency in people with established diabetes. Studies have consistently shown that those with lower magnesium levels experience more complications, including neuropathy, retinopathy, and cardiovascular disease. Supplementation with magnesium has been shown to improve insulin sensitivity and glycemic control in individuals with prediabetes and diabetes. Yet it remains an underutilized tool in the management of metabolic health. Many clinicians overlook magnesium as a therapeutic target, despite its profound effect on blood sugar regulation and its safety and affordability as an intervention, and hypertension is another area where magnesium exerts a powerful influence. It functions as a natural calcium channel blocker, helping to relax blood vessels and improve vascular tone. When magnesium is deficient, blood vessels tend to constrict, increasing resistance and elevating blood pressure. Several clinical trials have shown that magnesium supplementation can produce modest but meaningful reductions in both systolic and diastolic blood pressure. This effect is more pronounced in people who already have high blood pressure or are magnesium deficient. Magnesium also supports electrolyte balance, working in conjunction with potassium and sodium to regulate fluid distribution and vascular function. When this balance is disrupted, the risk of hypertension and cardiovascular disease increases. Magnesium's role in cardiovascular health extends beyond blood pressure regulation. Low levels of magnesium are associated with a greater risk of atherosclerosis, arrhythmias, heart failure, and sudden cardiac death. In the context of acute heart conditions, such as myocardial infarction, magnesium acts to stabilize heart rhythm, reduce inflammation, and improve oxygen delivery to tissues. Despite this, routine magnesium monitoring is not standard practice in most cardiology settings unless an emergency arises. Given away from the importance of magnesium in maintaining the electrical and structural integrity of the heart, this represents a missed opportunity in both prevention and treatment. The neurological system is equally affected by magnesium status. The mineral plays a central role in neurotransmitter release, synaptic plasticity, and neuronal excitability. When magnesium is deficient, there is an increase in excitatory neurotransmitters like glutamate, leading to heightened sensitivity to stimuli and a greater risk of anxiety, depression, and even seizures. Magnesium also influences the hypothalamic pituitary adrenal axis, modulating the body's stress response. People with chronic stress or mood disorders often exhibit lower intracellular magnesium levels. In clinical studies, magnesium supplementation has demonstrated antidepressant and anxiolytic effects, particularly individuals with mild to moderate symptoms. Migraines and chronic headaches have also been linked to magnesium deficiency. Low magnesium levels may trigger cortical spreading depression, a wave of brain activity that precedes a migraine aura. It can also promote the release of inflammatory substances that sensitize pain pathways in the brain. Clinical trials have shown that magnesium supplementation can reduce the frequency, severity, and duration of migraine attacks. Despite this evidence, magnesium is still not routinely in the treatment plans for headache sufferers unless pursued through integrative or functional medicine approaches. Even bone health is impacted by magnesium, though it is more commonly associated with calcium and vitamin D. Magnesium is essential for the conversion of vitamin D into its active form and plays a role in the regulation of parathyroid hormone, which controls calcium balance. Low magnesium impairs bone mineralization and increases the risk of osteoporosis. In older adults, magnesium intake has been positively correlated with greater bone density and reduced fracture risk. This highlights magnesium's systemic influence, reaching far beyond muscles and nerves to the structural framework of the body itself. Magnesium deficiency doesn't operate in isolation but acts as a multiplier of existing health risks. It magnifies inflammation, exacerbates oxidative stress, and disrupts hormonal signaling across multiple systems. In doing so, it contributes to the onset and worsening of complex chronic diseases that often appear disconnected on the surface but share magnesium deficiency as a common denominator. Addressing this hidden imbalance has the potential to not only alleviate symptoms, but to slow or even reverse the underlying pathology of these widespread conditions. Replenishing magnesium levels in the body begins with understanding where this mineral is naturally found and how it can be effectively absorbed and utilized. Whole foods are the richest and most bioavailable sources of magnesium, and incorporating these into the diet consistently is one of the most sustainable ways to restore balance. Dark leafy greens such as spinach, Swiss chard, and kale are particularly dense in magnesium because of their chlorophyll content, which contains a magnesium molecule at its core. Legumes including black beans, lentils, and chickpeas are also excellent sources, as are nuts and seeds like almonds, cashews, sunflower seeds, pumpkin seeds, and sesame seeds. Whole grains, particularly oats, brown rice, and quinoa, magnesium, along with beneficial fiber and phytonutrients. Avocados, bananas, and dark chocolate also contain meaningful amounts of magnesium, along with other nutrients that support cardiovascular and neurological health. Fatty fish such as mackerel and salmon not only provide magnesium but offer anti-inflammatory omega-3 fatty acids, which can work synergistically to reduce chronic inflammation. Even mineral-rich water from natural springs can supply magnesium, though in much smaller amounts. Eating a wide variety of these whole foods on a regular basis supports not only magnesium levels, but overall nutritional density, helping to counteract the deficiencies common in processed diets for some individuals, especially those with underlying conditions that impair absorption or increase excretion. Food alone may not be enough. Supplementation becomes necessary when magnesium stores are significantly depleted or when there is an elevated physiological demand. Magnesium supplements come in various forms, and their absorption and effectiveness vary depending on the compound. Magnesium citrate and magnesium glycinate are among the most bioavailable forms and are often well tolerated. Magnesium glycinate is particularly useful for those dealing with anxiety or sleep disturbances, as the glycine component has calming properties. Magnesium citrate has a mild laxative effect, which may be beneficial for individuals struggling with constipation. Other forms such as magnesium oxide are more commonly available, but tend to have lower absorption rates and a greater likelihood of causing gastrointestinal discomfort. Topical magnesium, applied in the form of oils or creams, and magnesium sulfate baths, Epsom salt, are alternatives for those who experience digestive issues with oral supplementation. These methods allow for transdermal absorption and can be particularly relaxing when used in a bath before bedtime. Magnesium threonate is a newer form that appears to cross the blood barrier more effectively and may be beneficial for cognitive function and memory support before beginning supplementation. It's important to consider individual health factors, such as kidney function, as excess magnesium can accumulate in people with impaired renal clearance. While toxicity from dietary magnesium is extremely rare, oversupplementation can lead to symptoms like diarrhea, nausea, and in severe cases, heart rhythm disturbances. This is why it's crucial to tailor magnesium repletion to personal needs, ideally under the guidance of a healthcare provider who understands the broader nutritional picture in addition to dietary strategies and supplementation. Addressing lifestyle factors that deplete magnesium is essential for long-term balance. Reducing intake of alcohol and caffeine, both of which increase urinary magnesium loss, can help preserve stores. Managing stress through practices like mindfulness, exercise, and proper sleep hygiene also supports magnesium retention, as chronic stress accelerates magnesium depletion. Medications that interfere with magnesium absorption, such as diuretics, proton pump inhibitors, and certain antibiotics, may require dose adjustment or close monitoring of magnesium status over time. Supporting gut health is another important piece of the puzzle, since absorption of magnesium takes place primarily in the small intestine. A healthy gut lining and balanced microbiota can enhance nutrient uptake, whereas conditions like inflammatory bowel disease, celiac disease, or chronic use of antibiotics can impair this process. Including prebiotic and probiotic foods in the diet may further aid in maintaining an optimal environment for magnesium absorption. And restoring magnesium is not simply about correcting a lab value, but about rebalancing the body's foundation for energy, relaxation, and cellular stability. It's about creating the conditions, through food, lifestyle, and sometimes supplementation, that allow magnesium to do what it was designed to do in every cell and every system. When the body begins to receive adequate magnesium, the changes can be both subtle and profound. Individuals may notice improved sleep, calmer moods, fewer muscle cramps, more stable energy levels, and a greater sense of resilience to stress.